Hi there, this is Doreen, and this video is a review of general test strategies and clinical judgment. As you know, nursing school exams are very different. We use critical thinking, clinical reasoning, and clinical judgment. So our exams are not just content-based, so we have to use some strategies to help work our way through them successfully. So clinical judgment is based on the patient care we give, which is based on the nursing process. And in order to do that, we must use both clinical reasoning and clinical decision making. So clinical judgment is problem solving that involves thinking creatively and using evidence-based responses. It's more than memorization. It's application and analysis level reasoning. Why should you care? And where should you start? Well, this type of questioning simulates the working environment and also is going to be similar to what is going to be tested on your next generation nursing board exam starting in 2023. So the application and analysis level of question is very important and we need to prepare for it now. So for general test strategies, we're going to start at the very beginning. And the very beginning is just rewording the question. So we want to just look at the question. You want to read the question very carefully and look for hints. Most, first, and best are priority. Further teaching is necessary. We're looking for something incorrect and say, what is this question really asking me right now? Make note of anything confusing, but take your time and read that question very carefully. Here's an example. A patient just returned from the operating room with a Foley catheter, an IV, an oral airway, and is unresponsive. Which assessment should be made first? So staying focused on just those descriptions and what assessment that you would do first based on that. Here's a question that states which is associated with a physiologic need of a patient with a colostomy. So the subject here is physiologic need, colostomy. As opposed to this question, a psychologic need of a colostomy. So the answer choices, I guarantee, are going to have both of those, and I have reviewed many exams with a student who chose the wrong side. So be very careful. One word changed the entire focus of that question. So this is a screenshot of page 1 of the general test strategy tips that's available to you on my Nursing Success shell under modules. We're going to go through most of these tips right now in this video. So topic of the question. Questions with words such as first, best, and initial indicate a priority situation. The question is asking what is the most important action you can do. Multiple answers may be and usually are correct. So you need to find the best choice in that situation. And here a nurse is attending a social event when another guest coughs weakly, grasps his throat with his hands, and cannot talk. What is the best action for the nurse? And I didn't give you answer choices because I just wanted to talk about this question. So you have to look at this patient, imagine as what is happening and what is our priority? What are we going to do first? In this case, it's going to be CPR. Okay, now the bolded area is the part that we're going to discuss next. And the topic of the question for teaching has been successful. When you see teaching has been successful, we're looking for a correct answer in your answer choices. And here is an example. A student nurse's order to apply wrist restraints on a client. The nurse preceptor reviewed safety measures for restraints. The preceptor knows teaching has been effective when which action occurs. So we're looking for that student nurse doing something correctly in these answer choices. So more teaching is necessary, of course, as we're looking for an incorrect answer. And I know it seems really obvious, but oftentimes, over and over again, students choose that beautiful textbook correct answer instead of the incorrect answer that this one is looking for. And here's an example of that. A nurse is reviewing information about HIPAA with a newly licensed nurse. Which of the following statements by the newly licensed nurse indicates a need for further teaching? So we're looking for something wrong. For example, the nurse says they can put on their Facebook a photo of their patient with their name. Of course, that would be a violation. We would need further teaching. So you're looking for a wrong statement. So keep that in your brain when you see that. I'm looking for something wrong. Make sure you stay on track with that. You have all the information that you need to answer the question. So here we have a nurse assisting with transferring a client from the bed to a wheelchair. Which of the following actions should the nurse take? Okay, not a whole lot of information here, a lot of room for what we call storytelling. The nursing student might say, well, what if they're obese? What if I need extra people? What if I need special equipment? What if the nurse has a backache today? What if, what if, what if? Okay, so you have to look at that question at face value. That's all the information you have. If it doesn't say it, it's not a problem. So just stay on track. You have all the information you need right there to answer that question correctly. Okay, next topic is in regards to the physician. So regarding the physician, only choose notify the physician if the situation is emergent and they need to be contacted immediately. So the NCLEX wants to test you to know what you as the nurse can do. Okay, and say to yourself, is there something I should assess before I call the doctor? What is the doctor going to call and or ask me about my patient? And I guarantee all of you will go out into the field and call your doctor to tell them about something with your patient, and the doctor will ask you a question. You think, darn, I didn't check that. Let me go do that. It happens to us all, and it's okay. But remember this. Remember, what assessment do I need to know before I call my doctor? Okay, a nurse is caring for a post-op client who suddenly becomes restless. The nurse should take which most appropriate action? So we have this pretty vague here. We have post-op and suddenly restless. A lot of things can cause that. The patient might have anxiety. They might be bleeding. Lots of things could be happening. It might be severe pain. We don't want to call the doctor with that until we know or have a better idea of what is going on first. So think about ADPI. We assess before we implement. Here's another example. The nurse is caring for a client who just returned from the recovery room after a tonsillectomy. The client is restless, the pulse is increased, and the nurse begins to assess right when the client vomits bright red blood. What is your immediate nursing action? Now, we have lots of stuff here, and there is a lot of assessment. We're just returning from a tonsillectomy. We had surgery, we're cutting the back of the throat. Client vomiting bright red blood. Do I need more assessment? No. I need to call my doctor because it's likely that the patient needs to go back to surgery, or at least that doctor needs to come and do something to help this patient. It's out of my scope of practice. I have enough assessment. I'm ready to act. Okay. You always have a physician's order for your answer choices, and here's an example. A nurse is preparing for a client for outpatient surgery. After you insert the IV catheter, the client reports pain in the insertion area. Which action should the nurse take? Okay, and you look at answer choice 2, 3, and 4, administer analgesic PO, request placement of a central line, and administer a local anesthetic. And none of those are the correct answer because we would remove the IV and place it at another site. However, if 2, 3, or 4 were the best response, they would be okay to choose because you will already would have an order for any of those choices. Okay, so don't eliminate an answer because you think I need a doctor's order for that, because you have an order. Now this section is on delegation and how we delegate. So we do not delegate ATE, assessment, teaching, and evaluation. Do not delegate assessment, teaching, or evaluation. Okay, and here is an example of that. The registered nurse is making out clinical assignments for the day. Which of the following tasks is appropriate to delegate to a licensed practical nurse, an LPN? And here I bolded them to make them really obvious. They're not going to be bolded on your exams, and they might not even use the word evaluate, teach, and assess, but they're going to use words that mean the same thing. So you do not choose evaluate, teach, or assess when you delegate. Okay? Don't pass the buck. Typically, answer that tells you to call someone else is wrong. I say typically here because sometimes it is a correct answer, okay? But we're testing to see what you can do. So keep in mind that when you see giving the job to someone else, it's likely wrong, but just put a red flag in your head and read it very carefully and be very discriminatory about that answer choice. You walk into a patient room to find him crying. When you approach, he says, "My family doesn't care about me." What is the best action from the nurse? Sit with them and provide support. Call social services. Leave the room because you have other patients, and ask the patient, why do you think that? So in this case, don't pass the buck. We're not going to call social services. We might need social services down the road, but right now, what is the best action? Simply sitting with your patient and providing them with support. This next section is about hospital. Okay. The hospital environment, when you're taking nursing exams or your NCLEX exam, is not the real world. And what we mean by that is you have all the time, you have all the resources you can possibly need. And just from your clinical experience alone, you know that that's not the case out there in the real world. So do not use that experience for your answer choices. This is NCLEX Hospital, and it's a perfect environment. You have everything you need. You have all the resources that you need. So forget about your past experience, whether it be personal, whether it be something you heard about in your clinical environment. Take the question at face value. So if you start thinking, boy, I had a patient like that last week and we did this, or my neighbor had that happen and they treated her with that, do not go in that direction. Okay? Stay on topic with what the question is asking and realizes you have everything you need. Realize that this is based on your NCLEX experience. On admission to the hospital, an elderly client appears disheveled and is restless and confused. During the client's second day on the unit, a nurse approaches the client to administer medication. The nurse is unable to identify the client because his armband is missing. Which of the following actions by the nurse is best? Okay, and we have 4 answer choices. Have the client's roommate identify him, ask the client to state his name, ask another nurse to identify him, or look in the chart at the picture of the client. And even if your institution doesn't have a picture of the patient in their chart, which many do now, that is the best way to identify a patient. So don't say, boy, they don't do that. If it's an answer choice and it's the best choice, then that is the correct answer. Okay? Patient first, then equipment. We have a client sustaining a fractured left femur in a car accident. She's placed in balance suspension skeletal traction using a Thomas splint and Pearson attachment. The client tells the nurse that she has terrible pain in her left thigh and keeps hitting the call light. Which of the following should the nurse do first? So picture this client. They're laying in bed and there's lots of cables and pulleys and weights with traction. Okay? Patient first, then equipment. You're going to naturally want to touch that equipment first, but keep this strategy in mind, patient first. So answer to 1, determine all the weights and ropes are in line. No. Answer 2, ask the client for more information about the location and characteristics of pain. Yes, patient first. 3, check the splint and Pearson attachment to make sure they're appropriately positioned. That's again, equipment. Turning off the call light, not only is that equipment, but we're ignoring our patient. So the answer here would be 2. Patient first, then equipment. Never leave your patient. Okay? You enter a patient's room and find them laying on the floor. Which action is best? Turn off the monitor. Again, that's equipment. Approach the patient and check responsiveness. Good answer. Approaching the patient first is great. Go find help to get them off the floor. A lot of students choose this because we don't want to deal with the patient on the floor. We want to get them back up in bed, but we do not go find help to get them off the floor. That's leaving the patient. And then proceed to take your noon vital signs. Kind of a silly answer, okay? So we want to approach the patient, check responsiveness, and then we might yell for help if necessary. Okay? Now this section is about treating patients in regards to physiology. In regards to physiology, we want to memorize lab values and expected outcomes. And I am very happy to report that next-gen testing is not going to require for you to have lab values memorized. And that's because hospitals are always going to give you the normal ranges. You will, however, need to know expected outcomes. So what does a high potassium cause, or what's going to happen if I have low calcium? And you also will need to know normal and abnormal vital signs. So those will need to be memorized. Here's an example. The nurse is caring for a post-op client who is receiving demand dose hydromorphone via a PCA pump for pain control. The nurse enters the room, finds the client drowsy, and records the following vital signs. And then we have a bunch of vital signs there. Which action do you take next? I'm not going to go through each one, but you need to look at that and say, is that normal or abnormal? And what would I do based on that value? And you are going to see a lot of this on your next gen testing. They're going to give you a lot of information like this, a lot of assessments, and say, is this intervention going to be helpful? Is this intervention going to be harmful? Based on how the client is presenting. Okay, so know your expected outcomes and your normal values. In regards to physiology, treat acute before chronic and unstable before stable. So a patient with a history of diabetes comes to the ER limping with a swollen ankle. The first action would be to what? And we have a choice here for blood glucose, and many students would say, well, maybe their diabetes is out of whack. No, we want to do stable, we want to do unstable before stable, and then acute before chronic. Okay, so we have an unstable ankle, and as far as we can tell from this, the way this question is written, we have a history of diabetes. We're not worried about the diabetes right now, we're worried about the ankle. Okay, so our answer choice here is going to be based on assessing that ankle or dealing with that ankle somehow. Look for keywords that show a change, for example, decreased. A nurse in a clinic is assessing a client who has AIDS and a significantly decreased CD4 T cell count. The nurse should recognize that the client is at risk for developing which of the following infectious oral conditions. So you need to know what a CD4 T cell count is and what it means if it's decreased and what we would look for based on that value. Okay, so the word decreased is important because you might see answer choices based for a normal CD4 or an increased CD4 if that's pertinent. Okay. Early signs versus late signs. A nurse is caring for a middle-aged adult female client who reports that her menstrual periods have become irregular and she's been having hot flashes. The nurse should expect the client to have which of the following manifestations associated with early menopause. And here, because I see the word early and because I review tests all the time with students, I'm going to guess right now that my answer choices are going to be early menopause, they're going to be just menopause, or late menopause. And it's going to be a combination of those, and I need to stay focused on just the ones that are early symptoms. Okay? Expected versus unexpected. A nurse is preparing a client for outpatient surgery. After the nurse inserts the IV catheter, the client reports pain in the insertion area. Which action should you take? So we did use this question earlier, but it fits in this situation too, expected versus unexpected. Now, it is expected for there to be pain while we're inserting an IV, but it's not expected for there to be pain after the IV is already in. Okay, it might be against a valve or near a nerve. It's just not expected. So we need to base our answer choice knowing that that is not something that we would expect. Assessments you do before giving medications. A nurse is caring for a patient that takes digoxin daily. The patient refused breakfast and is complaining of nausea and weakness. Which action should you take? So we have to look at that and we have to know dig. Okay, I know that dig, we can have toxicity, and sometimes that nausea and weakness could be symptoms of dig toxicity. What would I do? Well, I would check my heart rate to see if they're bradycardic, and I wouldn't give my dig if my heart rate was less than 60. It's important to know that. It's important to know what assessments you would give before giving a medication, and our answer choice would be based on that. And consider the patient description. It's another important factor. So a nurse is speaking with the mother of a 6-year-old child. Which of the following statements by the mother should concern the nurse? So the fact that the patient is 6 years old is important. So what is going to be concerning by the nurse is we're looking for something a 6-year-old shouldn't be doing for some reason, okay? So the description of your patient, 6-year-old child, is going to be very differently from a 15-year-old child or an elderly man or whatnot. So just stay focused on that patient description. It's going to be important. Consider the cause of underlying symptoms. A nurse is monitoring a client who reports having chills and back pain during a blood transfusion. Which of the following actions is the nurse's priority? So we have to think about a blood transfusion and what kind of symptoms could happen or what could be happening with a blood transfusion. And of course, we could be having a transfusion reaction is what they're describing with chills and back pain. And then I have to base my answer choice on what would I do if my patient was having a transfusion reaction? So those are the symptoms that are being described. How would I intervene based on those descriptions? Okay. How long ago was the treatment or a procedure completed? A nurse is caring for a child who's 2 hours post-op following a tonsillectomy. Which of the following fluid items should the nurse offer the child at this time? So this is 2 hours post-op. It's going to be different from immediate post-op, which will be different from 6 hours post-op and 1 day post-op, right? So you need to be very careful and make sure 2 hours post-op, that timeline is important for how I'm going to decide to take care of my patient. Okay. Now looking at answer choices. Looking at answer choices, we don't want to select answer just because it sounds right. And believe it or not, I review lots of exams and students choose something that they don't even know what it means, but it just sounded right. And it's something I hear almost weekly. So don't do that. Don't just pick an answer because it sounds right, especially if you don't know what it means. Don't add to the story. Review each option, even if you feel kind of sure about it. Make sure you review all of your answer choices. And then keep in mind that airway is not always the correct answer. We see airway and we pick A because we think A, airway, it's my priority, but airway is not always the correct answer. And here's an example. We have a 12-year-old boy arriving to the school nurse holding his right arm and crying. The skin on his arm is intact but with obvious deformity. What is the best action from the nurse? So they are basically describing a 12-year-old with a broken arm. Okay, so what is my priority, my best action for a kid with a broken arm? It's not going to be giving them oxygen at 2 liters per minute. There's nothing in the statement suggesting that he's having any respiratory difficulty. It's a broken arm. So my answer choice is going to be based on what would I do for a 12-year-old boy at the school nurse with a broken arm. Comma, comma rule dictates that all parts of the answer must be correct or it's all wrong. Here's an example of that. A nurse is preparing to perform hand hygiene. Which of the following actions should the nurse take? And here you can see lots of choices with comma, choice, comma, choice, comma, choice. And you can look at this and see, look at number 1, dry hands on patient bed. Well, that's going to be eliminated because we know that we're not going to do that. Look at number 2, move hands around quickly in the sink. That doesn't really make any sense. So I would eliminate that choice too. Number 4, rinse hands, check time. Well, we wouldn't really do that. It doesn't make sense. So whenever you see an outlier in there, eliminate the whole string. Okay. Eliminate similar answer choices. Okay, sometimes we can't tell the difference between 2 answer choices and that makes both of them wrong. The nurse is teaching a patient about medicine use at home. What is the best way to ensure his understanding of proper medication administration? And we have, how often do you take this red pill? Explain back to me how you're going to take your medications tomorrow. How many times per day do you take the red pill? Wait a second, that one sounds a lot like number 1. How often do you take this red pill? How many times a day do you take this red pill? That's the same thing. I can't discriminate between those 2, so I would eliminate number 1 and 3, and then I would look at 2 and 4 and hope that my answer choice was there. Okay? Eliminate answer choices that are too similar. And then you also want to pay close attention to answer choice that are opposites. Opposites often contain the correct answer. Not always, but oftentimes you will see that. And here's an example. A nurse is administering nasal decongestant drops for a client. Which of the following actions should the nurse take? We have assist the client to side lying, tell the client to blow her nose gently before installation, have them snort in quickly when administering. Wait a second, I see snort in quickly and blow nose gently. Those are opposites. So it's very likely that one of those 2 is going to be my correct answer. Absolute words like all, never, none, only, and always are often incorrect. General qualifiers like sometimes, usually, often are likely to be included in the correct answers. So just think about it this way. If I say you never take out the garbage or you always leave this work for me to do, doesn't it kind of make you a little mad? So for the most part, whenever you see those always and never statements, there's usually some kind of an exception to them, meaning it's going to be wrong. So just make sure you see those, put a red flag in your head, and really discriminate against that answer. A nurse is performing trach care for a client and suctioning to remove copious secretions. Which of the following actions should the nurse take? And we have always suction every 2 hours. Suction 2 to 3 times with a 60-second pause between passes. Never lubricate the suction catheter tip, and always have the patient cough before beginning suctioning procedure. So we have always, we have a normal statement, never, and always again. So just when you see those, just really discriminate that it's probably the wrong answer. Now we're going to talk a little bit about communication therapeutically. Okay? So therapeutic communication is a little bit different than other communication that we may do with our nurses. So when we're trying to communicate therapeutically, we don't ask closed-ended questions. You might do that during a patient assessment, though. You might say, do you have pain in your knee? And they might say yes or no, and that's very reasonable for your assessment. However, when you're trying to communicate therapeutically, we do not want to answer. We say, how are you feeling today? And we let them go ahead and elaborate on how that is. So eliminate answer choices that lead to a yes or no answer. We don't want to say any sort of version of don't worry to your patient, okay? That is going to offer false reassurance to them and they're not going to trust you. So anytime the answer is suggesting a don't worry situation, that's not going to be your correct answer. And also, anytime you ask a patient why did you do this? Why didn't you do that? It's going to put them on the defense. So we don't ask questions with the word why in them. And also, you don't want the focus to be on the nurse. So eliminate any answer choice where the focus is on the nurse instead of the patient. So your correct communication will usually be empathetic and reflect the client's feelings. Like, you seem upset. Tell me how you're feeling. And it will also give correct information. For example, there are many reasons for memory loss. Tell me more about what you're noticing. Okay, here's an example. A client is admitted to the emergency room with a diagnosis of acute myocardial infarction. The client tells the nurse, I'm scared, I think I'm going to die. Which of the following responses would be most appropriate? Here we go, everything is going to be okay, we'll take good care of you. False reassurance, we don't know that everything is going to be okay, do we? Do not tell your patient that. That is not therapeutic communication. I know what you mean. I thought I was having a heart attack once. Well, that is putting the focus on me and my experience. Again, not communicating therapeutically with your patient. I'll call your doctor so you can discuss it with him. Well, we learned earlier that that is passing the buck. We want to stay with our patient and we want to communicate with them ourselves. It's our job as a nurse. It's normal to feel frightened. We're doing everything that we can for you. This is reassurance to them, helping them to feel that you hear them, you're with them, and you're there to support them. So select all that apply. No one likes select all that apply. And unfortunately for next gen testing, your select all that apply are becoming a little bit more, let's say monstrous. I think the average is 9 answer choices for select all that apply. For some reason, I think statistical analysis has shown that 9 answer choices is a good discriminatory value for students to have to choose between. So for select all that apply, there's a couple things that will help you out. Select all that apply are content level. They are not application analysis. They are content level. And because they are content level questions, treat each answer as if it was a true or false question. So you're going to look at those answer choices and say, would this be true or false? Would this be true or false? So you have to decide individually for each one, select or discard that answer, and then just move on. And here's an example of that. Which of the following interventions are a priority during exacerbation of heart failure? Select all that apply. Okay, priority during heart failure. Is giving albuterol a priority for heart failure? I give albuterol for asthma, not heart failure. I'm not going to pick that one. And then you go through each answer choice and you say that, would I do this as a priority for heart failure? Yes or no. Would I do this as a priority for heart failure? Yes or no. So just choose true or false and then move on. And of course, you've got to have all that knowledge, all that content in there to answer these correctly. And then, of course, we have last dibs. We have grabbing for anything. We really just don't know the answer. And so we might be able to use the process of elimination in a case like that, hopefully. So if you're lucky, and this is a non-nursing question, which of the following was one of the original 13 states? I wouldn't know this because I learned that in 4th grade. So you can look at those answers and think, okay, Mars, yeah, Mars is not a state. So I'm going to go ahead and eliminate that. And I'm going to look at the other 3 states and think, oh, Virginia, wait, that's the only state on the East Coast. And I think that the East Coast was those original 13 states. I remember that much, so I can go ahead and choose B just based on that little knowledge that I actually do remember. So just do your best with process of elimination. If you can eliminate one answer, you've now increased your chances of guessing correctly based on what's left. And then I have one big random tip that I recommend all nursing students do, and that of course is practicing lots and lots of NCLEX style questions. NCLEX style questions, they're hard, but I promise you they get easier with time and practice. I am not by any means a content expert. I am constantly looking answers up and learning myself. But what I am right now at this point is a test taking master. I really am. I'm taking lots of courses about test taking and studying, and I've learned so many tips about it that I can take a test now for something I don't know about and do pretty well on it just based on my study strategies. That doesn't work perfectly in nursing school, but it will help you a lot. Okay, but NCLEX questions specifically help put your brain in nursing mode. So even if you get all of the questions wrong on your practice questions, you're going to learn how to critically think your way through these questions. Which answers are hardly ever correct, which ones are most likely correct. And I also want to remind you that when you have your NCLEX questions, read the wrong answer rationale too and say, why isn't this answer correct? Because oftentimes there's something to learn from the wrong answer too. Maybe it's give 2 liters per minute instead of 6 liters per minute, for example. So just knowing that difference between that can help you learn little bits for that topic too. Okay. And I hope you found this helpful. I hope that you will come back to this and think about it and use it for your testing and also your NCLEX practice exams. And as always, if you want to connect, send me a message. I'd love to meet with you and chat. I hope you found this helpful and that you have a great day. Bye-bye.